right, so we're recording, we're ready to go. If each of you would go ahead, I'm Liz Irwin with Belong Disability Ministry from Highland Park United Methodist Church, and I would like to welcome our panel of mental health professionals. And so if each one of you would like to go through and just state your name, where you practice, and the primary population that you serve through your practice, and any other little details you'd like to share, that'd be great. So Laura, would you like to start us off?
Sure. My name is Laura Vogel, and I am a licensed psychologist. I am the Director of Therapeutic Services at Momentous Institute, and we are a nonprofit that serves children and families around the Metroplex. We also have a community school as well, but we serve not just children at our school, but we serve the wide community. We really work to reduce barriers to mental health treatment. So we work on a sliding scale. We don't bill insurance, but what that also means is we don't have to make a solid diagnosis every single time for someone to get services. And our sliding scale really is working with families about what can you afford to pay. And we won't turn anyone away if they aren't able to pay. You know, we work with children and then the families, you know, within which children exist. And so that can be a wide range of presenting concerns. And certainly, you know, work with a lot of children with developmental differences and, you know, autism spectrum disorders, that sort of thing, but as well as children who are presenting with anxiety, depression, any sort of, quote, acting out behavior, which we know can be a function of a lot of things. So it's a range that we serve. And all of our services also are provided in both English and Spanish, if that's important.
That's wonderful. Thank you. Melinda, would you like to go next?
Hi, I'm Melinda Bird. I am a board certified behavior analyst. I work with a couple of places in the Dallas-Fort Worth area. I kind of consult here and there. And so, but I mostly work with some children, but I mostly work with older teenagers and adults and have done so for a while. And I've been a BCBA for about 5 years and then worked as a direct, like a therapist, one-on-one direct with clients over the years. And I've worked in many different settings, but my focus typically is on addressing problem behaviors, but I like to come at it from a teaching standpoint. So teaching skills that are missing or need to be strengthened to help kind of reduce the occurrence of those problem behaviors, especially any escalated behaviors that we might see.
Awesome. Thank you so much. Cherissa?
I kind of do what Melinda does. I'm a licensed clinical social worker, and my background, I was an educator for 18 years, and I specialized in special education and Asperger's, autism. I then got my master's degree, and I changed completely to working with adults and as a director at an MHMR here in Wise County. And I did that for 7 years, and now I work for Deer Oaks Behavioral Management, and it is primarily supportive care for the elderly in nursing homes for a lot of behavioral issues. People who don't want to eat, or, you know, that failure to thrive has taken over. And in the afternoons, I work for a Sure Source, and I do just completely telehealth therapy for younger children. I have a lot of 6-year-olds to 18-year-olds, and a lot of them have mood dysregulation disorders, and just a lot of depression and COVID depression, social anxieties. So I'm kind of working both ends of the assembly line right now during my day.
That's awesome. That's awesome. I love that we have such a wide variety of professionals and professional experience. So thank you, each of you, for sharing that with us tonight. So question for the whole panel. In your practice right now, how are you seeing the pandemic affect individuals and families that you serve? And you guys, whoever would like to go first, go ahead. Any takers?
We're going to be polite. We're going to polite for each other. I can jump in.
Raise your hand if you have something to say to that.
I can start, and then so maybe I'll come at it from abroad, and then we can narrow. I don't know.
Yeah.
You know, of course, and I imagine there, Melinda and Cherissa are going to say similar things, but seeing a lot of increased anxiety, depression, like this is the pandemic has been obviously hard for all of us. And seeing families who are experiencing so much uncertainty, and is that uncertainty about jobs, uncertainty about health, lots of loss, and of course when that happens when adults are stressed, children react to that. Kids really struggling with this adjustment to virtual school, or if it is in person, it looks different than it did before. So even if I'm going back, quote, to brick and mortar school, it's not what it's not what it was last year. And so lots of struggles around social interactions, just their own worries, keeping up academically too. That's been a real challenge for a lot of the families we're working with. There are some subset of children who do great with virtual learning, and then there's a large subset where this is really hard for kids to stay self-motivated, to engage, to keep up, to make progress. So that's like a broad sweep of what we're seeing.
That's true. And especially with children that are IDD and have autism, when their schedules change, it throws everything out for them. And most of the times parents don't even know day to day, are we going to be home? Are we going to be in school? What's the schedule going to be like? Even if they are, doing virtual school, their sessions change all the time. And so I'm seeing a lot of that. It's the fluctuation of schedules that the children are having a really hard time staying focused, because they're insecure about what's going to happen day to day, and who's getting COVID in their schools, who's not there. And it's a lot of inconsistency for them, and they are having a really difficult time keeping up with that. And that's really hard for those little guys.
Yes, similar. Yeah. I have had a couple of families I've worked with that actually have kind of found, I guess, a routine with COVID. And so they are making the most of it. And I would say that that's been interesting. I've had a couple of clients actually like make progress through this period. And I don't know, like, it's like a good thing, but then at the same time for everything to be taken away, and then that's how progress is made. It's kind of adds a whole other thing to it. But I would say that yes, I would say that for the most part, just the changing. And I think that just the big things, like one of y'all said earlier about the big things like lost jobs and housing and some of these other big, losing people. If anybody's lost a family member or has one that's really sick, then you put the school stuff and the therapy stuff and the, day program. One of my friends has a family member who participates in a day program, and that has changed. And so you add that on top of it, it's just this compounding issue that and right now, for the foreseeable future, it doesn't, there's not really we're not really feeling like the hope, or at least I'm not. So I think it's just challenging all around.
Yes.
And I think too, like for those, especially because we focus on children, that struggle with some of the social skills, social interactions, the subtleties that go along with that. If I'm at home, we're seeing kids, some of those skills really begin to,
Yes.
slide. Because I'm at home, and of course, all of us at home are different than we are at work or at school, or, we have to use different social skills in those settings than we do at home. And if I'm not having to practice those and utilize them, they begin to shift. And it's kind of a use it or lose it sort of thing for skills that are challenging to begin with. If something's easy to begin with, then you just kind of fall right back into it. But if it's a skill that's challenging to begin with, and then I'm not being pushed to use it, we're seeing a lot of slide there, just because by virtue of being isolated and being at home.
Or even just the those that like being at home really liking being at home now.
Mm-hmm.
So now you have the opposite problem where they're that social anxiety increasing, and they don't even want to leave the home, or they don't want to leave mom or dad or whoever might be the preferred caregiver. And so then you've got this whole other issue that is probably.
Yeah, you froze for a minute, Melinda, but it sounds like just losses of independence kind of.
Yeah, and I think parents at home may actually see behaviors improve in that regards, because the challenges of the day, because being at school can be challenging. And so I really work hard all day to do what I'm supposed to at school. And then oftentimes parents will see kind of that decompression at home, where big behaviors can show up. So we might be seeing the flip, where at home, maybe things are a tiny bit better, but because they're not being pushed or having some of the stress of the social. I know that's not going to be the case for every family, but you can see some of that.
That's very interesting. Just kind of tagging onto that, and you've maybe mentioned it a little bit, but are you seeing any benefits to kind of repositioning the home and the school and kind of reconfiguration of routines? Are there any benefits that are happening, or is it really just mostly challenges?
Well, I think similar to what we were saying, for those kids with a lot of social anxiety, where that just really can take over a lot of what, just their whole day.
Mm-hmm.
If I'm in a secure place and I feel comfortable the majority of the day, those anxieties are decreasing. And so I think they probably feel better right now. I think as adults, we can see the bigger picture of, okay, but eventually, what will happen. But right now there is this sense of comfort and ease. And so there, in some ways that is a benefit. And so you see parents getting to have different kinds of interactions because their children aren't as stressed and aren't kind of, having those moments of dysregulation.
I wonder, or part of me thinks too, that maybe some families have taken the opportunity to just kind of get rid of some of the stuff too. I know that before COVID, a lot of us were overscheduled, and COVID made us kind of realize that harshly. But so maybe hopefully some families have kind of taken advantage of that and kind of done an inventory basically, and thought, what can we do without? And then just knowing some families too, as a provider, I've noticed some skills that maybe we just didn't really realize the value of certain skills when you're stuck at home all the time, when you can't go out. Well, being able to engage in some leisure activities, or some just play things around the house, or being able to play by yourself or entertain yourself if you're older. Those are really valuable skills. And if everything is always scheduled, then you don't have those opportunities to practice those skills as much. So I think those are just good opportunities for us professionally. But I think it's a good time to kind of do a checks and balances too, of just making sure that we're spending our time how we want to spend it. or that our children and our loved ones are spending it, how they want to spend it too, and
Yeah.
helping them kind of make those decisions for themselves.
That sounds really healthy. Yeah. Well, thank you for that. All right. So this one's kind of targeted towards Cherissa and Laura. What are some warning signs for mental health concerns in children that parents and caregivers should be aware of? And what about, and also to children who might be nonverbal or less verbally expressive? Any thoughts on that?
In many ways, I think even for children who are verbal, the first signs are likely going to be some nonverbal warning signs. So when we think about changes in like how they're sleeping, or suddenly they're sleeping more, or suddenly they're sleeping, their sleep patterns are changing. They just seem edgier, perhaps less patient. Changes in eating, that sort of thing. We're going to see those signs often first. Even like I said, with kids who are verbal are unlikely to say, I think I'm feeling kind of depressed about all this, Mom. It's going to show up in these interactions that feel different, because parents know their kids better than any mental health provider does. And so you're going to know something's different with my child, something's off, and it's not just a day. It's been, a pattern of time where I'm sensing that they're struggling more, interactions feel harder, patience is less, that sort of thing.
That's great. Cherissa, do you have anything to add to that?
Yeah, I was thinking along the same lines too, because we do know our kids, better than anyone, and just the things that you notice, mood swings, their eating, sleeping. But one of the things that as all of us too, that I would like to remind parents is that when you go to a doctor, if you want to consult your doctor, or you go to a therapist or someone to help you with your child, to try to go through a period of time where you keep specific notes, so you can say on these 15 days they didn't eat anything, or something specific that will have something for the doctor and your therapist to grasp onto, because being just general and saying they're always in a bad mood doesn't really tell anyone anything. So if parents can keep a diary or journal or just a calendar, just to write little notes down, this day threw a temper tantrum over taking away the remote control, or just anything to help keep specific notes and not just be so general, that will really help parents too kind of see a pattern of what's going on with their child. But it really gives that person that's helping the children to something to really sink their teeth into and to start with. That's really important.
That's great information. Thank you. Let's see, Melinda, so similar question, but targeted more towards teens and adults. So what are some like warning signs that adults, and even like a self-advocate, someone who's, pretty with it and, tries to handle a lot of their own healthcare needs or that kind of thing, but what should they be on the lookout for when it comes to mental health concerns?
A lot of what was mentioned for children also applies for teens and adults, I would say. And keeping the calendar is a really great idea, because it just provides the doctor a little bit more background, so that they can see like if it's something that's been going on for just a couple days, or it's kind of random, or if for these few solid days I've been feeling this way. I think just recognizing just when you're not, if it's more like if you're feeling more like sadness or like more of these feelings like tired or whatever, just really finding ways to describe it. And if you're having trouble describing it, I would say to find maybe concrete ways, like, well, I just want to lay down, or I want to, like move, or I don't feel like getting up and doing something, or I don't want to talk to a friend. And I would just kind of, like make those concrete examples. And then as from caregiver standpoint, just observing those kinds of things. And I think sometimes too, just, you know, as we're all kind of going through this pandemic time, that day to day is totally different, or even morning to lunchtime to nighttime is different for everyone. And that if someone's having a bad day, you know, write it down, maybe make a note, but try not to get so caught up in like that it's, you know, a bad day. And sometimes too, people, you know, there's a lot of physical reasons why people don't feel well. We especially like depending on the person's skill set and their communication level, they may not be able to exactly tell you my stomach hurts or I have a headache. But you know, behavior isn't always, and I know this, but behavior isn't always like a specific reason. Sometimes it can just be that you don't really feel well, because I know that most of us, when we don't feel well, we are not nice people and we don't want people to mess with us. And so I would just kind of say to take it day by day, and also just to reach. That's why it's helpful to have people close to you that know you, that you can reach out to and talk to, so that someone who is like a self-advocate would be able to reach out to a caregiver or a parent or a friend or someone who, you know, knows them, and they could say how they feel, and someone could kind of say, oh, okay, yeah, I think maybe you should talk to a healthcare provider or a doctor or something. We can, you know, and even if you're thinking, oh, I think they're fine, it never hurts to just, you know, just make sure everything's good to go. Never hurts to just check things out when you're not sure. So I know for me and my family, it's always best to, it's just better safe than sorry, I think. So you never know. More help is never a bad thing, you know?
True that. That's a really great philosophy, because I think oftentimes families or myself included are thinking like, you know, you might go to the doctor, you get a little cough checked out or something, or if it's been persistent for a while, but we often think of like our mental health in that same way. Like, you know, it's better, let me just go get checked out. Let me go talk to my doctor, see if I'm okay, if I'm coping well with this situation, or if it's, you know, better safe than sorry. I like that. It's really great. Okay, Laura and Melinda, what are some helpful techniques that caregivers can use to help de-escalate or manage challenging behaviors that occur at home?
So one thing I would say to caregivers is just to take a deep breath. And I think that sometimes, especially like in the behavior circles, we might say to, like, you know, walk away, redirect, ignore. And while sometimes you do have to do that for safety reasons, I think that if you can get in before the behavior escalates to where it's pretty high level, if you get in at the lower level where maybe it's just like whining, or maybe some crying, or just stomping around, or something that's a little bit more like less intense, if you can kind of respond to that behavior, sometimes you can prevent it from escalating. And I also think just being supportive, trying to ask you know, your child or your loved one, like, if they want something, or can you help them with something, or even just trying to if it's because like something's not available, redirecting them to something that is available, provide some choices, and even kind of just work through some coping strategies, or just trying to help them just feel kind of just supported. I think that that's really important, especially if there's really nothing you can do about it. Just you know, sometimes things happen, unfortunately, and you just kind of have to work through it. And it's okay to be sad, but hey, we can go do this other thing over here. We can watch this movie instead, or we can go outside, you know, or whatever. So
Yeah, I would agree with all of that. You know, I think the less is more when it comes to talking. You know, like our instinct is to try to convince people with lots of words about what, you know, and I'm guilty of that as a parent. But I think the less we can talk at kids, especially if we can't prevent. I mean, obviously prevention's the best way and to try to, de-escalate early. But if we get into these bigger emotions, I think less words often is helpful. And preparing ahead of time for these moments of big emotions. And so I like to talk with families about, we have to practice utilizing some of these skills when children are calm, because if we wait until they're, really having a big moment of big feelings, neurologically, their brains are not available to us to ration, to go through skills. And so we want it to be sort of this just automatic response that maybe you've got a few visual cues that help them kind of get into that, but it's practicing those skills when they're calm. So even if it's something as simple as deep breathing, let's do that while we're calm, so that then when you need it later, your body remembers what to do. Having, a toolbox kit, basket of toys or sensory items that are calming, that is there for the child to utilize when they're in these big moments of, like, I'm starting to have this big feeling. What do I do with it? I can go to my sensory box or my toolkit, my calm down box, if you will, and get those items. But again, you're practicing those ahead of time, and that is reserved for these moments. It's not something I just play with whenever, but it's when I want to practice my calm down skills, when I want to, or I need it because I'm upset. We talk a lot with kids about their brains, and some kids can understand that, some can't. Tina Payne, Bryson, and Dan Siegel have done a lot of work helping parents understand, that upstairs brain, like I'm making a decision, versus my downstairs brain, where I'm not making a decision. My emotions have taken over, and no amount of reason is helping me right now. But they use that hand model of the brain, and I know a lot of people have seen this, where you think about, like, so this is not us, this is Dan Siegel and Tina Payne Bryson, totally stealing this from them. But this idea of the middle part of our brain, which is our limbic system, our amygdala, that's the emotional part of the brain, and it's much deeper in our brains. The thinking part of our brains, you think about, is, the cortex, and we want access to the thinking part of the brain. But when we're having really big emotions, we flip our lids, and then you don't have access to this. You're only dealing with the big emotions. And so even having hand signals of, like, are you here? Are you here? Just so that and kids are taught this, so then I don't have to use words. It's like, I'm here. But it's the whole thing is practicing and then utilizing once we're having these, big feelings, that it's a skill I've already developed. But just, even understanding some of these things, and for kids who are more verbal, who have a deeper understanding of that, like, your brain has flipped its lid. We're going to help your brain calm down. We're going to help your body calm down, versus you are making bad choices, or you are in trouble. In that moment, if you can depersonalize it so a child doesn't feel sort of, like attacked or guilted, like, right now we're just going to take care of your brain and your body to help you calm down. Later we can talk about, when you made this decision, here's the consequence of that decision.
Right. Well, that's great. I love that visual too. Thank you so much for sharing that. That's really helpful.
And I can give you a link, that you can include later if you want access to, their work.
That'd be great. Yeah, I would love to share that. All right, Cherissa, so everybody's on Zoom. We're on Zoom right now, right? It's a great way to connect. Very much a fan of it, but I also feel like Zoom fatigue is very real, and that's something that we're hearing about in our community. I'm just hearing all around. And so we know that it's a great way to connect with people. Some people are receiving therapy through Zoom. Some people are going to school virtually. So do you have any pointers or tips for families on how to manage screen time for especially kiddos, and then also stay connected to the support networks and family connections and things like that they need?
I read something very interesting just a couple weeks ago about Zoom fatigue, and it was comparing if you are having a live conversation with someone, you are not actually staring at them for 5 whole minutes, 10 whole minutes, 20 whole minutes, and compared to a Zoom meeting where you feel like you have to be staring at the computer to show that you're fully engaged and that you're showing attention, and that's hard for adults. I mean, like me too. Like, I'm just thinking, my boyfriend, he bought me an early box of Valentine's candy, and I'm over here thinking about the candy, thinking, if I look away, am I going to be rude? Because you know what I mean? So kids are the same way, and I always hold on to that old teaching, those old teaching thoughts that for every age number that they are, that's about how many minutes of engagement you're going to have. And so, you know, to keep that true with computer time also. So if they're 5, you're going to get about 5 minutes with them, you know, to keep them fully engaged. If they're 12, you're going to get about 12 minutes of time when they're fully engaged. And so I think that's just very important to remember. I have one young boy that I see, and he's 8, and he doesn't really like to do Zoom meetings with me, but he will do them, but he'll just show me the top of his head. So I know, and I tell him, okay, if I can see the top of your head, I know that you're there. So, and he's paying somewhat attention, and he can repeat to me everything that we talked about in the session. So you have to be a little bit flexible with children, and you can't expect them to just be staring straight into the camera all the time, and just be a little bit lenient with them, because I mean, they're involved in Zoom meetings all day too, and so that's intense, and that fatigue is there for them also. And by the time we get to them, it's usually at the end of their day, and they're kind of done with talking to people on a computer. So I think just really remembering their age and just being a little bit more lenient. And, you know, if they're halfway off the camera, but you can still see them and know they're paying attention, that's okay. So yeah, that's just important to know that it's real for them too.
Awesome. Well, thank you.
And I've seen stuff, you know, too, to like help with putting it on speaker view, because like watching both myself and you, that's a lot of work. And we're not accustomed to being able to see ourselves when we're talking to other people. So that's why it's very, very taxing for everyone. So changing that to speaker view. And it could be triggering for some kids too, to see themselves on camera. They just don't like it.
Okay.
One thing too.
That's great. Thank you both. So last question. So things for some are changing almost daily, because if people, like we mentioned, are going back to school or going back into their day habs, which is great, you know, people are excited to get back into their routine. And then sometimes a school is closing because it's got too many COVID cases, or a day hab, you know, has to close certain classrooms because, you know, people have been exposed or they've had some COVID. So what are some ways that caregivers and self-advocates can cultivate a flexible mindset so that they're able to cope with the changes that are really unpredictable right now? Y'all are all so polite.
I would say that just to like, it's easy to focus on like what we can't control. That's what most of us do just naturally. So I think just trying to like, accept that, okay, that happened. We can't change it or control it. And to try to, and maybe like focus on, like, think of something, like if you're going to have to be home, then think of something fun or that you enjoy that you can do at home. And so like a parent could try and think of like a fun activity they could do at home, or maybe it's a special meal that they don't always make their child. Maybe they make pancakes, the next morning for breakfast or something. Or if, an adult, maybe they have a, just like a, not a, like really, I guess a movie night or just something that you don't normally always do, but just something to kind of look forward to kind of make the most of not being able to do your normal routine. I think that we all kind of had that sense, like at the beginning of COVID, there was so much like free stuff online, like YouTube video, like for all kinds of people, all kinds of things. And we've kind of lost that momentum, but I think that you could still do it. And maybe if you're not having to get up and go to school and someone's able to be home, maybe you have a bubble bath the night before, because, you have a little bit extra time maybe, or just like not, still keep a routine, but maybe just look for something to put your focus and energy on instead of, what you can't do,
Okay.
Yeah, just reminding, everyone in the family that change is okay and that tomorrow might be different, but, that's how we're going to roll. That's why we're learning to get through this time period right now, is just knowing that every day can be different, but it's going to be okay still.
Yeah, and I think adding a little bit to sort of that prep part of it, like we've all talked about, for younger children or children with less verbal skills, using social stories to help prepare that sometimes school will be different. Some days we will go to school, some days we will stay home. Some days, I won't, someday, so every morning I will look to see if I'm going to school or I'm staying home. I'll be sad if I can't go to school, but that's okay. Like going through those social stories, that kind of helps begin to prepare them. So if we have a sudden change, we can get this social story out and we can go through it and we could talk about, okay, so this is some of the things we've practiced. Having a schedule that, children get in that routine of, the first thing on the schedule is where will we be today? And they know that we're going to check that schedule. And so today we're going to be going to school, but it could be a lot for some kids to not know until the day of, but setting that routine of we're going to check it every morning and then the schedule will tell us what we're going to be doing that day. And for really young children, using some if-then kinds of statements or pictures, if my teacher feels good, then I get to go to school. If my teacher doesn't feel good, then I stay home. But there's those visuals that get paired together to break it down in these more for younger children or children who need more support around that. And having those things sort of in place as they're trying to manage this flexibility. And then so if I stay home, then I get to do these cool things, but if I go to school, then I get to do these cool things. So because you're probably going to have the reactions to just the change, number one, and then if it's a change where if I prefer home and now I got to go to school, or I prefer school and now I got to stay home, so you've got kind of two things you can be trying to manage. It's both change and then my reaction to the less desired outcome, if that's.
And that's perfect, because children with autism, they really rely on schedules and visuals. And so having two of those, doesn't hurt, for them to have, just like you said. I mean, that's perfect. If we go to school, this is what the day looks like, but if not, this is what our day may look like. And so that's always great. And I know it's a little time consuming, but I know a lot of parents that have autistic children, they do kind of thrive on those visual schedules. So having two might be a really good option also.
And and I like having, and I'm sure, I mean, parents listening to this are the most creative people ever, but having pictures with Velcro where you can just change out the sequence of the, so it's not something permanent, but things can get changed. Um, there's lots of creative ways to help give that visual, but just knowing that we have to check the schedule each day.
Right.
Yeah, it's
Yeah.
great.
It sounds like that forward planning piece can help mitigate so much. If you can do a little bit of that planning ahead of time, then they can process the changes much easier, it sounds like. Awesome. Well, thank you all so much. Do you have any other thoughts or things that you'd like to share about that I haven't asked or anything like that when it comes to mental health with individuals with IDD or autism? No pressure.
I think just, and I know, I mean, as a parent myself, those decisions you're having to make about what's a risk I'm willing to take, what's a risk that's just too much. But wherever, parents are feeling safe, especially for kiddos who are struggling with some of the social interactions, just if they can't be at school because it just doesn't feel safe, if there are safe ways, people in their bubble where their kids can get that interaction and be practicing some of these skills, I do think is really important, especially for younger school age children right now, as those things are developing and growing, expanding, really trying to make sure they're taking some, or trying to think through, where can I give my child that opportunity if school has been, is not an option.
That's really good. That's really good. Finding those places where you feel safe to allow them the space to exercise those skills. Because you're right, it's kind of like flexing a muscle. Like social skills are kind of another muscle, and if they're not being utilized, then they're gonna decline for sure.
I mean, I think even adults who have been away from work and working from home, when they begin to re-enter the workplace, it's like, oh yeah, how am I supposed to behave here? It's a little different than I've gotten accustomed to. Having my dog next to me, or wearing yoga pants every day. There's just all of these things we're all going to have to readjust to. But as adults, most of us can kind of slide back, okay, I remember this. There's that muscle memory. But really trying to help support some of not losing some of that muscle memory, for lack of a better word.
I think that's a great way to describe it. Makes a lot of sense. Well, again, thank you so much for joining me tonight. I really appreciate getting to hear from each of you, and I'm really excited to share this recording with our Belong Disability Ministry community. So thank you again, and y'all have a great evening, okay?
Thank you so much for having us.
Thank you.
Great.
Of course.